everybody to today's Welcome everybody to today's webinar, Growing a Sustainable Workforce, Opportunities and Challenges. We have a great learning event ahead of us today on a topic very important to your organizations. So thank you for sharing your time with us. My name is Liz, and I'm a Program Manager of Technical Assistance with the Technical Assistance Research Center, otherwise known as TARC, here at NCUE. Joining me from NCUE are Molly and Sean, who will be helping on the back end. We are honored to have you all here today, and we kindly ask that you place your name, your organization, and your tribal affiliation and title into the chat box. In addition, we welcome any feedback you would like to provide about your webinar experience in our survey, which is also posted in our chat box. Next slide, please. For those of you who are new and unfamiliar with NCUE, here's a little background. The National Council of Urban Indian Health, also known as NCUE, is the national nonprofit organization devoted to the support and development of quality, accessible, and culturally competent health and public health services for American Indian and Alaska Natives living in urban areas. NCUE is the only national representative of the 41 Title V Urban Indian Organizations, or UIOs, under the Indian Health Service and the Indian Health Care Improvement Act. NCUE strives to improve the health of over 70% of the American Indian and Alaska Native population that lives in urban areas, supported by quality, accessible health care centers. Next slide, please. This event is made possible by the Indian Health Services Cooperative Agreement Funds. This event is solely the responsibility of the National Council of Urban Indian Health and does not necessarily represent the views of Indian Health Services or the Department of Health and Human Services. Next slide, please. Please note that this session is being recorded for educational and quality improvement purposes. Next slide. This slide just features some basic information on Zoom. When you entered the room, your mics were muted, but during our Q&A, if you do have a question, you can hit the unmute button to share your question with our community today. Please turn on your video. We hope for it to be interactive. And as I said, if you haven't done so already, please enter your name and organization into the chat box. Next slide, please. So to ask a question or a comment, at the bottom of your screen, you'll see a little chat box. All you need to do is click on that. It'll bring you to a box and you can enter any comments or questions that you have. We'll also be posting some links in the chat throughout this webinar, so feel free to cut and paste any of the links that might be valuable to you. Great, next slide, please. So today's healthcare organizations are facing a number of different workforce challenges, including widespread staff shortages, increased demand for services, and overwhelming staff burnout. The shortage of health workers and its impacts was magnified during the COVID pandemic and its aftermath. Workforce challenges are complex problems with a variety of underlying causes and the need for innovative and data-driven solutions. As leaders in your organization, your aim is to build a resilient workforce that meets the demand of services, which ensures high quality of care. Over the next hour, we will explore these issues by touching on the following learning objectives. Understand how to employ best practices for incorporating employee feedback on workplace experiences to empower and retain current workforce. We'll learn how healthcare systems can expand thinking around workforce issues to plan strategies to address and sustain today's healthcare workforce needs. And lastly, to identify ways to incorporate staff wellness programs to enhance employee engagement and satisfaction. Next slide, please. So before we get started, let's take a few minutes to come together to answer the following questions by sharing our own insights. Sean is going to pull up a whiteboard, and I've posed some questions. Let's see if we can get it up. Perfect. Can you make it a little bit bigger, Sean? So it's pretty easy to use this whiteboard table. On the left, is a tool bar, and you can post emojis, or you can use one of the drawing tools in there. And I'm asking 3 questions today, just so we can see where everybody's at. The first one is, from a workforce perspective, what did last year look like for you? The middle question, what are you doing to hire, retain, and engage employees and keep talent in-house? And then the third question is, what are the biggest challenges that you are facing right now? So it looks like for many, being understaffed is what the last year has felt like. Let's take another minute or so. Great. Well, thanks everybody for sharing. It seems that we are feeling many of the same impacts of workforce challenges, doing a lot of the same things to hire and retain employees, from offering remote work to bonuses, to employee wellness programs. And some of the biggest challenges are training, retention, hiring. So yeah, thanks everybody for participating. And now I'm going to ask for the next slide. And give a warm welcome to our speakers today. They come to us from the Native American Health Center, which is located in the Bay Area. So please put your favorite emoji into the chat box as we welcome Anthony Guzman, who's the Chief Cultural Officer at Native American Health Center, and Michelle, who's the Chief People Officer. So the mic is all yours. Next slide, please.
I thought we'd, just since we're in such a, we got so many relatives here, we're gonna start off like we always do at all of our meetings here at the Native American Health Center. So I'm gonna offer a quick prayer, and we're gonna burn some of this cedar to give you all some virtual smudge here. So I'm gonna light this right here. That's for everybody. And then I'll go ahead and offer a prayer before we get started. Creator, I woke this morning in a beautiful city filled with wonderful people. I breathed deeply knowing I would be amongst resolved relatives this morning on this call, relatives that love the community and that serve the people. I thank you, Creator, for this blessing to be with them, to contribute to the work of our predecessors and our ancestors. We work towards a flourishing community that's safe for all of our people across the country. Today, Creator, we ask you for your grace and your guidance in our decision making. fill us with wisdom beyond our knowing, and protect the most vulnerable in our communities and that are among us. I say this in a humble way, all my relations. Thank you all. Michelle.
Oh, thank you. Thank you so much, Brother Anthony. Good morning. Good morning, everyone. My name is Michelle Shawnego. I'm half Puerto Rican and half Native American. On my mother's side, I come from the Taino people of Jayuya, Puerto Rico. And on my father's side, I'm Shawnee, Kickapoo, Muskogee Creek, and Sac and Fox. So I come from Oklahoma. My grandmother was part of the relocation, and that's how my family and I ended up in the Bay Area, and we've been here ever since. So I just wanted to know who you're speaking with or who's presenting to you today. I have the privilege of currently residing as the Chief People Officer of the Native American Health Center in the San Francisco Bay Area. And I've had the pleasure of working here for 15 years. So majority of my career has been in human resources, either in healthcare or in the high-tech industry. So thank you all for having me and for joining this presentation today. Today, we're going to go over just a little bit about who the Native American Health Center is, what have been some of our workforce challenges over the past year or so, and how we have addressed those challenges. And then we're going to open it up for questions. I also want to just offer just my just to connect. I know a lot of you guys aren't on camera right now, but if for some reason you have questions after the presentation, or you would like to hear more about some of the initiatives that we've rolled out here at the Health Center, Liz, if you could please just send out my contact information after, I'd be more than willing to connect after this presentation with anyone that would like. Go ahead, next slide. Go ahead, Anthony, this one's you.
Sorry about that. I was responding to emojis on our thread. You know,
Hey.
the Native American Health Center, it's been 50 years. And, you know, early in our prayer, I wanted, you know, when I talked about our predecessors and our ancestors, we really, and I think every single one of us on the call, we stand on the shoulders of some giants. And so I'm just so happy to be at the Native American Health Center contributing to all of the fantastic work. And, you know, here in, you know, Native American Health Center was initially founded in the Mission District in 1972 in a response to not just the unmet social needs of the Bay Area American Indians, but let's also remember why these programs exist in the first place. And it had to do with the historical context, the wars, the relocation, the genocide, the wars. And so to have these facilities and these organizations across the country right now is really a response to that. But over the last 50 years, you know, Native American Health Center has grown into a large organization. And what does that mean with our workforce? We'll jump into that a little bit and my part, and Michelle will definitely address some of those things. But one of the things that we absolutely believe in here is culture is prevention, and the importance of our culture and our service delivery. These are all things that are integrated in every aspect of our, not just our programming, but also into the very fabric of our work life here at the Native American Health Center. Today, we stand amongst all of you as one of your relatives, as one of the largest urban Indian health programs in the United States, and we are continuing to grow. Right outside of my window right here, we have our 3050 project that will be coming up, that will have our cultural center there. We don't have very much space right now. We do with what we have, but with this new building, we're going to have a large cultural space, enhanced and more beds, or I'm sorry, chairs for our dental. And so we'll get back into that in a little bit when I have a little bit more time. But that's who we are as the Native American Health Center. I'm going to turn the time back over to Michelle.
Thank you. Next slide, please. Before we get into our workforce challenges and strategies, I really wanted everyone on the line to understand the size of our organization. So we have 15 sites, and we provide services in 3 different counties within the Bay Area. 8 of those sites are school-based clinics. We have about 15,000 members, and we provide comprehensive whole person care. So we have medical, dental, behavioral health. We have WIC, our community wellness program, which is also social services, and a lot of our traditional services come out of that department. We have a staff of about 300 to 315 employees. 30% of our workforce identify as American Indian or Alaskan Native. So that's a really big milestone for us. So 100 of our employees are Native. And I wanted to also paint a picture, just so you have an idea of the workforce that we're working with, is that 45% of our staff have been here 5 or more years, but 20% of our staff have been here under a year. So really, like, without this data, I'm unable to do my job in a strategic way. I need to know the kind of employees that we have, the average age of our staff. That really helps me design the programs to fit our workforce. If majority of our workforce is between the age of 40 and 50, the types of trainings that I roll out might be slightly different versus employees earlier, like maybe in their early 20s. And we average between 10,000 to 14,000 unduplicated visits and 35,000 to 50,000 visits per year. Next slide, please. Workforce challenges and strategies. Go ahead. Before I get into the challenges, I took a quote from our behavioral health director. He's a psychologist, and he has been employed with our organization for about 10 years now. And Dr. Springer says, we want to meet the needs of our community, but have yet to find a qualified LCSW. And we've been searching for one for over 10 months. So I know the struggle is real, and it is challenging to hire providers right now in the current environment. Next slide, please. Here are some of our workforce challenges. It's kind of a short list. I didn't list all of them. I tried to kind of pick and choose what I thought would be relevant to the audience today. But from a recruitment and retention standpoint, we had a lot of turnover compared to previous years in terms of why people are leaving. So if you look at the graph on the right, you can kind of see our turnover rate ranges anywhere from 26% to 20%. However, if you look at the blue bar, those are the areas that I tried to target most, are for staff that are actually leaving for other employment, right? So in 2021, 40% of our separations, those staff left for other employment. And that was my goal, was to try to reduce that. We all know there's going to be turnover. There's positions that are high turnover positions. A lot of our frontline staff, medical assistants sometimes seem like they're a revolving door. However, there are other roles that we can really focus in on and put our retention efforts in that area. So in 2022, we closed out the year with 12% of our separations, which was 20%, left for other employment. And I don't know if you guys have this number, but the national average in 2022 was between 30 to 33% for our industry. We also had a really low applicant pool. Applicants just haven't been applying, and we've been posting our jobs at various locations. And a lot of the applicants that were applying in the healthcare industry, they wanted a significant amount of compensation. They wanted more compensation than what we were offering. And we're in the San Francisco Bay Area, so we have Kaisers, we have a lot of large hospital systems, UCSF, that we're competing against for the same applicants. So we had to get really creative. And we also had a lot of challenges around remote workforce. The applicants that we were seeing, nobody wanted to come into the office. Everybody wanted to work remote. Some of the workforce concerns, or we started, what did that do? We started hiring more inexperienced staff, people either right out of college, or some staff that had or even high school that had very little experience in the workforce. We also started seeing an increase in crime and violence in our service areas. So as you know, like we work in East Oakland. We're in the Mission District in the heart of San Francisco, where crime is really high. I mean, there's shootings right down the street from our organization. We have staff walking between buildings, and sometimes they may get robbed. It's really challenging. Like, we're in a really challenging area. And also we were dealing with burnout, staff burnout. And then also as a leader of the organization, I've never managed a remote workforce before. So having to pivot and now implement a remote workforce environment and learn how to manage remote staff, it's a lot different than being able to see everyone when you walk out of your office. It's different. So I feel like over the last 3 years, what the pandemic has done, it is transformed how human resources operates within organizations, in my personal opinion. Next slide, please. So here are some of our strategies. I'm going to go over a recruitment strategy. So after 2021, I was like, how can we continue to, what can we do? There's a very low applicant pool. What is a change? What is a strategy that I can implement? How can I help move this organization forward? My first instinct was to hire a recruiter. So we have successfully we've hired an internal recruiter within our HR department, and we took away all the administrative tasks from the supervisors to free up their time to do other things. And what I mean by that is now our recruiter schedules all the interviews, conducts the phone screens, does all the reference checks. And some of your organizations may already have this, but that was not the case for our organization. So I hired a recruiter. We had increased applicant pool. We also started using staffing firms only for like either strategic positions or for providers. So I looked at 2020 and 2021, and we utilized over $300,000 in staffing firms for those 2 years. So I was like, this is ridiculous. We need to be able to save money, and we actually have been able to do that by hiring a recruiter for 1/3 of that cost. We've strengthened our partnerships with a lot of schools, local universities, junior colleges, also other community-based organizations. And we do have other Native organizations within the Bay Area, and we really partner with them in terms of like getting the word out for our open positions. I also implemented an employee referral program. So now if you're an employee here and you refer an applicant and they complete 6 months of employment, they will receive anywhere between $5,000 to $2,000 for every hire they refer. That is very intriguing for our staff. It's a way for them to actually make additional money, and they don't want to hire you don't want to hire someone who's not going to be a good fit for the organization that you care so deeply about. And on the back end, we were improving operational processes. Go ahead, next slide. Here are some of the engagement strategies. So we redesigned our new hire experience. So this is something that we're constantly working on. There's a quality improvement component within my department that doesn't just belong to the medical and dental quality. It belongs in, I believe, all areas of the organization. So I look at how we can improve processes on an ongoing basis. And we really wanted to ensure that the new hires coming in had a good experience and that they want to work here. So we shortened our application process. We give like a handwritten welcome card now to all new hires. We implemented which is called gamification. So instead of things being paper-based, we really try to make it like trainings and learning fun. And we use this tool called Kahoot. And Kahoot is like it's almost like a survey and a way to gamify and like create a competition. I wish I could show you guys here today, but I would say if anything after today, go look up Kahoot, do a demo. It's really inexpensive and it's a fun way to have to engage staff when it comes to trainings. We implemented a new applicant tracking system, which is more user-friendly. So now applicants can apply online by they can sync their LinkedIn profile with us, or they can upload like their Indeed resume. So it makes it a lot easier for people to actually apply for the job. We now review our strategic plan at new hire orientation. It's not this hidden document on the S drive. It's a live document, and we want to ensure that everybody coming through the door is aware of our strategic priorities, and it connects them to the organization. And we rid all of new hires of the administrative tasks on day one. So instead of starting on your first day and filling everything out, going through all that paperwork, we do that before they come on board. So we have what's called now a pre-onboarding process. So they actually do all of their administrative tasks before their first day. And a really big change is structural changes. Like look at your organizational chart. So Anthony and the development of both of our roles were a strategy to the workforce environment, but we now have a chief people officer, which is myself, and Anthony Guzman, who is our chief cultural officer. So now our employees have a voice, and I have a seat at the table with the C-suite. And I'm able to predict and look at the workforce. I'm able to look at the work environment and bring strategies to the organization instead of being reactive all the time. We're trying to be more proactive and get ahead of it. And Anthony can talk a little bit later on about what his role is within the organization. Next slide, please. Here are some of our retention strategies. Although what we also did over the last year is we raised our minimum wage as an organization. We all know that the cost of living has increased significantly, especially in the San Francisco Bay Area. Some of our staff were making incoming wage of like $16, $17 an hour, which is just not a livable wage for the Bay Area. It's just not. So we raised our minimum wage in 2022 to $22 an hour. So that is the minimum wage. That's the lowest wage somebody can make in our organization. And we created new compensation scales for every classification within the organization, which it ended up costing us around $2.4 million. However, we did it in stages. And I worked really closely with finance and operations to look at what our productivity had to be able to meet these numbers. But I would highly suggest looking at your compensation scales. We also have a mentorship program, and we do a lot of succession planning here. So rising stars at NEHC. So I work really closely with all the directors just to ensure that the directors are always mentoring someone, right? In the event that they had to go out for a long period of time, who is that person? Who is your right hand? Who is that person that you're investing in, mentoring, and showing the way? So I'm a really big advocate for learning and development. And I think employees want to do a good job, and they want to do it well, but it's our responsibility to tell them how to do their job and ensure that they have the tools to do it well. In 2022, we promoted 30 employees. So we're really, this shows you that we're really big on learning and development and promoting our internal staff. We have career ladders for almost all of our classifications. This is just one example. So our medical assistants, there's MA1, an MA2, an MA3, and then an MA lead. So there's 4 different career paths for a medical assistant and where they can go without going back to school, right? And when you get into the medical industry, sometimes it's challenging. If you're a medical assistant, the only way to move up in some people's mind is, oh, I have to go back to school and become a nurse. Not everybody wants to go back to school and become a nurse. Some people really truly enjoy being a medical assistant. So how can we be creative, and how can we develop that employee and give them a career path here at the organization? And we also enhanced our benefit package. In terms of staff burnout, we noticed that a lot of providers did not want to work full-time anymore. So we changed our business model. We no longer just hire full-time providers. We will hire 2 part-time providers to equal 1.0 FTE. But in doing that, we have to make it competitive. So we now offer health insurance, and we offer our part-time employees a benefit package. We also have hiring bonuses for providers that range anywhere from $5,000 to $10,000. And a year service bonuses. So this was a way to retain our long-term employees. So our years of service bonuses range, they're in 5-year milestones, starting at year 5, because we noticed that employees started leaving either within their first year or after their 4th year. So those were our 2 kind of tipping points. And so now our staff can get a bonus in the amount of $250 all the way up to $5,000 once a year if you hit your milestone year. And we also offer a relocation stipend if the employee does not live in the service area. So if you're moving from another county and you're still in the state of California, we do give a stipend to those who are moving closer to work for our organization. Next slide, please. I'm going to turn it over to, oh no, this is still me, a data-informed culture. So you hear me a lot talking about data. service years, knowing the average age of your employee. I feel like in order to really know, in order to create strategies that are sustainable, you really have to understand your organization, and that is through data. Their data tells a story, it always does. So next slide, please. So incorporating employee feedback. So HR has incorporated an evaluation component into all of our initiatives, all of them. It's really important that we get employee feedback. So we roll out surveys. Something that I'm really proud about is our 45-day stay interview. So a couple years ago, I nixed the exit interview. We no longer conduct exit interviews. If you are leaving our organization, I don't really want to hear from you. I want to hear from the people that are still working here. Why do you work here? What keeps you working here? And how can I help you do your job better? So now every employee will get a stay interview. And the supervisors, we were noticing that staff were leaving for a while within their first year of employment. So this is required along with the 90-day evaluation, but they're done at 2 separate times. So really it's just a protected time that the employee sits down with their supervisor and they talk about their job, they talk about career growth, what's working, what's not, how can I better support you? And we also incorporated 360 evaluations for our leadership. So anyone that is in our executive leadership team gets an annual 360 survey. So they get to see what their staff feel, and it's anonymous. And that seems to be working very well. And we also roll out evaluations after every training. We have what's called Staff Appreciation Week. So I'm sure we all know, but in August, there's a National Community Health Center Week. It's usually the 2nd week of August. And that full week of August is all my department rolls out employee. It's called our Staff Appreciation Week. And we do Spirit Week, where you can come to work dressed as a twin, or you can come dressed in your favorite Marvel character. And we have staff lunches, games, scavenger hunts. Sometimes we'll go to the A's game. So it's that whole week is just dedicated to staff. And something that's currently in progress, especially entering into my new role, is I'm going to be rolling out an employee engagement survey. So that will be coming out here in the next couple of months. Next slide, please. I'm going to turn it over to Anthony.
One of the things that I had never experienced in the workplace before I got to the health center, Native American Health Center, was no meetings week. I know Michelle didn't talk about that, but that's definitely one of my favorite implementations through the HR department. 4 times a year, no meetings week. You get the email comes out from the HR department, clear your schedule. There's a kind of an ongoing joke that we still end up having meetings, but at least they're the meetings that you kind of want. So, but that has been tremendous for us. And I just wanted to throw that out there. Thank you, Michelle.
You're welcome. I'll just touch on that really quickly. So we have no meetings week once a quarter, and it's the month that has 5 Wednesdays. So whatever month where there's 5 weeks in a month, that last week, there's no meetings. So just FYI.
Yeah. And just to give a little bit more emphasis on the chief people officer, one of the most important things about that position is demonstrating to the organization and to the employees that we want the employees to know that they have a seat at the table. So Michelle does a fantastic job at making sure that the concerns of the workforce are addressed in the C-suite level. So talking about data, we conducted the medicine bundle survey. And when we think about a medicine bundle, we think about it can be very unique to each individual who has a medicine bundle. Maybe they put their own uniqueness in there for their own wellness. But as a clinic, we thought, how do we get informed by the community to see the kinds of needs that they would like and see the services that they would like to be provided to them to ensure that they get a great experience coming to their primary service provider. But the medicine bundle was also part of a larger project called longevity, which is a NAHC led initiative that discusses what does it mean to incorporate land into the health of our people and to the people who walk in through our doors. This survey was conducted to ensure that we are providing the most comprehensive healthcare services that we possibly can. And the longevity movement, I want to call it, is starting to really flourish right now. And so we're very excited about that. Keep following us on social media to see the ongoing developments of that. So let's go ahead and go to the next slide, please. So in this medicine bundle survey, we started out by asking our staff this first question. Out of the 300 employees that we have here, we have 100 Native employees. And our CEO, Martin Wakazu, our fearless leader of 40 years, one of the things that he emphasizes is that we aren't just employees. The community members, the Native American staff here at the health center are also community members. So when they leave work, they also are attending our powwows. They're going to other community events that are with Indian Intertribal Friendship House, the Friendship House, American Child Resource Center. As you all know, you have your community-based organizations that you all work with, but as community members, we thought it was really important that our staff also talk about what it was they would like to see in the organization when it comes to traditional healing. So when we asked that, would you like more access to traditional health? Out of 636 total respondents, 554 of them said yes. Now, again, we started off with the health center employees, but as we opened this up and started asking community members at all of our other engagements, this is what they said. One of the other questions was, has a negative experience with a healthcare provider, not understanding your language or culture, ever made you feel like you didn't want to go back? And what you see when there was 40% said yes, and that's out of 589 total respondents. And so that's still a very, very large number. And when we think about, particularly in our perinatal programming, that if a mother goes to a healthcare provider and finds that they didn't want to go back, that has huge implications on the community and the health of the people. So let's go ahead and go to our next slide, please. I want to say one more thing before we move on. We self-identified Two-Spirit and trans relatives also answered that same question, and 99% of our trans and Two-Spirit relatives stated that they had a negative experience and they didn't want to go back to the healthcare provider. And again, such an important data collection from us by doing this. I know we're talking about community, but again, I want to emphasize our staff, our community members as well. We feel like incorporating that into our work culture is really important. And so when we ask, what are some of the services you would like to see out of the new cultural center, which is, we've talked about the 3050 project, that new cultural center will be in there. And so here are some of the respondents. You'll see traditional crafts, ceremonies, educational and prevention groups, cultural learning groups, talking circles, sweat. As you can see, there was a pretty good size and percentage of people who wanted to see a sweat lodge. And I'll say today, for the first time in the history of the Native American Health Center, we are constructing our very first sweat lodge in the center of the Oakland campus here. And we are going to dedicate that to one of our employees who served as a voice of the people. She ensured that the people amongst us that were most vulnerable had a voice. And so our dearest Janet King, we are naming that space after her. But as you can see, we took the data from the community and made sure that we utilize it to make sure that we are providing the best possible care. So we can go to the next slide, please. And so just a little bit of some pictures on what that sweat lodge will look like. Now, I did see a few names I recognized out there in the list. Jackie Shirley out there, and Ryan, where are you at? These are some relatives out in Salt Lake City at the Urban Indian Center, and they might be familiar with this space right here. But we are also looking at building a sweat lodge that has this same type of atmosphere at the health center. Now, this will only just be for staff. Michelle touched on this. The highest peaks of violent crime in the Bay Area are right in the epicenters of where the Native American Health Center is. Not too long ago, we had one of our staff members just across the street. I can see Wendy's from my desk right here, and she witnessed the shooting. But, but prior to that, we've had other incidents where there were shootings during work hours where the buildings had to get locked down. And when those things happened, we responded. Even when we talked about, Janet, when she had passed away, we used the space that was available to us. But now that we have our ceremonial space, those types of issues can be addressed in our ceremonial space. Now, I also want to emphasize this. It's not only times of tragedy that we would use this space. We also offer our, we can go to the next slide, please. We also offer our staff members, next slide, please, one-on-one counseling with our traditional practitioners, group and talking circles with our traditional practitioners. Because after that 2 years of the pandemic, the amount of stress that all of our providers experienced across the board, whether it was our mental health providers, our medical providers, our social service providers, they all felt the weight of those times. So now to be able to provide our practitioners or our staff with the practitioners, I think we've really heard how much they appreciate that. And not only is it just our native staff that take advantage of our traditional practitioners, our non-native staff also have reached out and said, hey, I would like to talk to Martin Martinez, who's one of our folks that comes through. I'm going to move on here, talk about our new hire orientation and my role. One of my roles as a chief cultural officer. In that new hire orientation, I have the pleasure of meeting every single staff member that comes into the organization. And what I provide to them at that time is a context of who we are as a Native American Health Center. I touched on it at the very beginning. It's not just that we are providing services to the community, but it's also reminding them actually where we came from in the historical context of why each one of our urban Indian organizations are in the cities that they are in, many of them. The relocation programs and the attempts to assimilate and to terminate the trust responsibility by the federal government. So not only do we provide them the context, but we also help them understand where we've come from. It's one thing to walk into the Native American Health Center and see, a 3 and 4 building campus here and just coming into another FQHC, but it's another thing to actually get a history of the modest beginnings of the organization and the grassroots organization of who we are. So many of the staff that work here do understand that, but I think giving a history and a context is so critical. Now, there's a big difference between cultural competence and humility. I oftentimes tell a story about my cultural competence going back home to my reservation and becoming a licensed clinical social worker and working with the people there. I know the tribal politics, I know the families, I know the ceremonial and the seasonal calendar. But one of the things that really sets us apart is our humility. I had a story where I had this client that was coming in and I recognized the name and I said, oh, this person, I know their family, and I started to create this own idea of how they were going to behave when they entered treatment. And this young person demonstrated to me a very different picture than I had painted in my mind, which really made me feel ashamed about my assumptions about her. And so that was always a teaching that held with me, and that's the humility component. Even though I had the cultural competency, I was lacking in my humility at that moment, and that's always stayed with me. And so that is something that we really emphasize here when staff come in, and we're continuing to start to have those trainings and conversations throughout the year as the Chief Cultural Officer starts to integrate deeper into the organization. Let's go ahead and go to the next slide, please. And one of the things, I'm gonna do a time check real here. Now, one of the other things that I've really enjoyed about working at the health center, and one of the first times I've experienced this, we have a cultural committee. And so this cultural committee is a representation for many of our departments. There is a larger emphasis in our social service human department, but we are making sure that our member services, our behavioral health and our medical team have representations there, but ensuring that we're sharing and celebrating our culture. And what does it mean when we share, when we celebrate culture? It also means honoring. And so we have this is always something where we love to honor our staff, and not just for work-related issues. You know, sometimes we found, oh, someone's a student graduated from high school, and so that's a big celebration for everybody here, regardless if they're Native or not. We want to honor. There's a new baby in the family. You know, it's so great for us when we get to, you know, send somebody a card, or, you know, present them with a blanket. But we really want to make sure that we honor our staff, and the cultural community has a lot to do with that. I'm going to jump down here to emphasizing connection to the community and the land. As you saw in our medicine bundle survey, we made that connection, but our cultural committee has a tremendous amount of support in making sure that the longevity project is as guided with ancestral wisdom and values. We'll go next slide, please. And we talked a little bit about this, but, you know, the stress of the pandemic, honoring our staff, talking circles, healing circles. And during each one of our departmental retreats, we always ensure that, you know, those that attend those retreats have the option of participating in some ceremony. I was very fortunate enough to get to go to our medical retreat, where we taught some stories about the sage and its importance to the culture, and provided a blessing and a healing for all of our providers. And when I asked those if they wanted, whoever wanted to participate, it was volunteer only. Every single one of our you know, members of our medical department got up and wanted to participate. And I think that really demonstrates the type of work culture that we have, that people feel safe and they feel comfortable enough to participate in something like that. So I think we can move on to the next one if there's anything left. I did want to say thank you all for your time, and I'm going to turn the time back over to Michelle to just make sure that she doesn't have anything that she wanted to wrap up with, or if I had left anything out.
No, thank you, Anthony. I'm excited to get into Q&A and see if anyone has any questions, but I'll turn it over to Liz.
Great, thank you. Thank you, Anthony and Michelle, for sharing so many great insights. I loved the no meeting week once a quarter. I think that's a great implementation, and one that many insights that we can all follow in our work. And with that, we will open it up to the Q&A. Please feel free to take yourself off mute, or you can post in the chat, and I will read the questions out. I know we had a couple that came in. One was somebody was curious about exit interviews, and you're thinking that they're not beneficial to the organization. Is it a compliant issue? So when did you decide to stop the exit interviews, and are there any times when you think some of the data or insights might be useful?
Yeah, that's a really great question. So we stopped exit interviews, but we still have what's called an offboarding, right? So really what that means is we still meet with the employee on their last day. And really the only thing I really want to know is the number one, what is the reason they're leaving? I want to know the one reason. But outside, we used to have this really robust exit interview, like, what do you think about our benefits? Is there anything we can do better? I'm not saying it's not beneficial, but I don't necessarily want to hear that from someone that's made up their mind to leave the organization. I want to hear that from someone who is currently employed with the organization. What can we do better? So from a compliance perspective, there's no compliance issues because we're still doing the offboarding. We're offboarding the individual and we're knowing the number one reason why they're leaving. But in terms of collecting feedback on how we can improve our work environment, I want to hear that from staff that are currently employed with us, that actually are invested in our mission and not like deuces, I'm on my way out. Good luck on replacing me. So, you know, that because sometimes people can be bitter on their way out. So does that answer the question? Okay.
Yeah, she says, thank you for the clarification. Super helpful. We have another question. Somebody was wondering if you might be able to share your survey instruments used for the 45-day check and 360 data collection for managers.
Yeah, Liz, I'd be happy. If you want, what I can do is I'll send you our 45-day interview template. So just so everyone knows, I'm certified in HR strategic leadership and also certified employee retention professional. So a few years ago, about 5 to 6 years ago, I certified the organization with the Retention Institute. If you guys aren't familiar with him, but I would, if you guys are in HR or you're responsible for retention, there is a great resource. It's called the Retention Institute. And there's actually a certification process that you can go through. You can put somebody through it in HR, or you could reach out and actually certify your organization with other best practices. So the 45-day stay interview is actually something from the Retention Institute that he's more than welcome. He gave me the green light to share the tool. We did customize it a little bit, but yes, I will send that to you, Liz, and you can share that out with the group.
Great, yes, and anybody who's registered, we do send a follow-up email so we can include that along with slide decks, and we do a one-pager as well. Could you speak a little bit to, you spoke a little bit about remote work. This comment was, remote work has exacerbated generational misunderstandings. Have you seen that in your work, and how have you bridged those employees that might be able to work, you know, a little bit remote, or do you have, you know, a hybrid work environment for some folks?
That's a really great question. So we have a hybrid work environment. I'm happy to share our telecommuting policy if you would like to see what that is, but we have a minimum of 3 days of on-site work. So that is our way to kind of try to be fair and consistent. I will say our quality department, yeah, I might see them 1 day a week, but they're working with data. So they probably can work home remote a little bit more, but it is definitely challenging, especially when you're looking at it from like a generational standpoint. My rule of thumb is just because you don't see them doesn't mean they're not working. And I think that's what a lot of leaders feel like, just because I don't see you physically here. So you really have to, we're still working through this and training and teaching our managers to be able to manage by results. So we've implemented a few checklists, and like, if you are working remote, like here's a way to log your work. I'm happy to share those templates, but they're like Excel documents, so staff can like track what they're actually working on, and it gives the manager some ease. But we're also still working through those challenges. We have a lot of work in that area. Like some people, let me give you an example. We're now rolling out Microsoft Teams agency-wide, but for the last 2 years, some people might be on Microsoft Teams, some are on Slack, some are using Google Meets. It was all over the place. And so we're really having to look at our administrative processes and improve them, from HR to bringing on consultants, check recs. So we're working on that right now as well.
Great. Any other questions? Angela asks, how many employees do you have?
Around 300 to 315.
And I think
we're also unionized. So I don't know if anybody else is unionized, but we're a unionized environment as well. It makes it a bit tricky.
Great, Ms. Lester, I see that you have your hand up.
Yes, thank you so much. This has really been wonderful. I was the one that asked or mentioned the issue with regard to kind of generational issues. Being Gen X, I was raised a latchkey kid, free range, very independent. And so, my entry to the workforce, if somebody told me, mark down the Salt and Peppa CDs, I wasn't going to ask if it sparked joy in my life. And I know the way I'm asking this question, I already sound like an asshole. What I'm trying to figure out is how to, people have a lot of different emotional needs that I don't know that, like the best way to meet those and how to even have conversations about those, because everybody's so super stressed out right now and kind of managing all the different needs when everybody has very different needs, just and being a super small staff, we're just like 7 people, trying to find the best way to do that so that everybody feels genuinely cared for, because we do care for people, but what makes one person happy really irritates the crap out of somebody else, and just trying to have balance has been difficult. So wondering what kind of lessons you've learned from that.
That is a really great question, Carrie. And when it comes to, our staff, imagine managing 300 staff. During COVID, we hired a total of, we were up to almost like 370 employees. So we were one of the largest testing facilities in the state of California and the largest in the San Francisco Bay Area. We partnered with FEMA. So our response to COVID was a bit different from some of the other UIOs. Like we were in the thick of it, just because of where we're also located. But when our staff are feeling burnt out in that way, like we really lean on our traditional practices. So that's kind of where I call on Anthony to really bring us back to like our traditional ways. And like I think we did a community blessing, and we have like talking circles. I mean, sometimes we'll even bring out the altar with some. I'll turn it over to you.
Yeah, I did want to say that there's 2 things. One is a little bit more of a practical one. I'll start with the traditional practices. Even within our community partners out here, I think as Native organizations, we started with the prayer, reversing sage, and offer some traditional knowledge and teachings and stories. And that might just seem really normal to us, but when we look at the rest of our area that we're living in, I think they had higher turnover rates. And I think that's why now people are really looking at, well, how do you integrate culture into the workplace? Even if they're a Latinx community, African-American organization, they're saying, okay, that actually starting to make sense in how that works. So social determinants of health and integrating culture into the workplace is something that I think we've all naturally done. And I think other organizations are starting to catch up to saying, hey, maybe there is value in doing that. And so, during this hard times, we were able to, lean on our spiritual and our cultural practices. And number 2, before I became a chief cultural officer, I was the director of the community wellness department. And I had, we had around 40 staff, 9 managers. And the thing that helped me support those particular staff members is just being very, very diligent about ensuring that each one of the people I supervised got their weekly supervision. That was key. Once I was there, I had to make sure that it wasn't, oh, I'm pushing it out because I'm too busy. That was one of my priorities, to ensure that each one of my staff, I had that relationship with them. Because I heard this a while back, but and I know we're getting close to time, but one of my mentors said, your supervisees are your caseload, and they each need something different. So just make sure that you meet each one of their needs, because they're going to be different for each one of them.
Great, thank you. And I know this discussion is great. We'll need a 2.0 later on this topic. But next slide, please. We're going to drop the link to our evaluation in the chat box. Please take the time to do it. This will also be included in our email follow-up. It helps us to better our programming, and we learned today how important data is. So we would really appreciate you filling out our evaluation. And next slide, please. Please visit the NUCUI website to learn more about some upcoming events. We have an event on April 27th, the Journey of Healing Domestic Violence Training. 2 COVID conversations, May 25th on long COVID, and we're going to be hosting an open forum on the 31st on weaving self-care into everyday practice. And then we will have our 3rd community of learning session for our HIV grant on June 8th. And last slide, please. And we also are hosting our conference if you haven't signed up already. More information can be found on our website, and this year it will be in person, May 15th to the 18th. And with that, we're at time. I want to thank Michelle and Anthony again for graciously joining us and sharing so many wonderful insights. And thank you for everybody for coming today and joining our community. Have a great day.